This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks for joining us for USVI News. I'm Emily Matson. We begin today with the very latest about the coronavirus situation here in the Virgin Islands. Our USVI News, Ali Bourne-Vanek, brings us the very latest.
Emily, the numbers are just below 200 when it comes to COVID-19 cases in the U.S. Virgin Islands. The territory currently has 193 active cases, 120 on St. Croix, 68 on St. Thomas, and 5 on St. John. The Department of Health is continuing to urge USVI residents to get the vaccine, and also they shared statistics that put into perspective how the Delta variant has affected the territory's health systems.
We ended July with 37 deaths. 7 died of COVID in July. Our second highest month death total, 19 people died in August. By far our highest monthly total that brought us to 56. Going back to the beginning of the pandemic, 18 and a half months ago, that's how long we have dealt with it in the Virgin Islands. March 13th, 2020, there was the first VI positive case. A week or so later, we closed schools, stopped cruise ships, limited gatherings to 10 persons, limited restaurants to takeout only, closed non-essential businesses. We did not have a vaccine or many medications or treatments, so we shut down to build capacity. April 5th was our first VI death. April 16th was a second death and the first in the hospital in St. Thomas. April 17th was a third death and the first death in St. Croix. Remember, we had 19 deaths in August 2021 alone. The 19th death in the Virgin Islands was recorded on September 11, 2020. It took 159 days from April to September to get to 19 deaths. To get to the next 19 deaths, giving us a total of 38, it was not until August 1st of 2021, a month ago. It took 324 days. 159 days for the first 19 deaths, 324 days for the second 19 deaths. Now listen to this. We had 19 deaths in the past 31 days of August. If it wasn't for the monoclonal antibody treatments, over 575 so far, the numbers would have been even higher. We had between 200 to 400 active cases in the community daily since late July. We have asked this in the past, and so did Chairman Finch. What is the acceptable death number to convince others to do the right thing? December 16, 2020, the first vaccines were given. We have 9 months of vaccines to date. It's the best tool we have. It's free and easily available.
For more information, the Department of Health is hosting a COVID-19 vaccine town hall meeting on September 10th at 5:30. You'll hear from different health professionals in the community, answering questions that many people in the community have. The town hall meeting is called Hope, Not Fear. In St. Thomas, Ali Bourne-Vanek, USVI News.
Sounds like a great way to get any answers to questions that you may have about the coronavirus vaccine. And speaking of vaccinations, September is Labor Month. We're just off of Labor Day. So the Department of Labor is doing its part to keep the VI community safe by making sure workers in the territory and really anybody else who wants one has easy access to a COVID-19 vaccine. This week, they're hosting vaccine drives in St. Thomas and St. Croix. Tuesday, September 7th, the drive took place in St. Thomas. And later this week, on Thursday, September 9th, the vaccine drive is set from 10 o'clock in the morning until 2 in the afternoon at the VI Department of Labor's parking lot on St. Croix. They're hosting the drives in conjunction with the VI Department of Health. Nationwide, the CDC says there have been more than 40 million confirmed coronavirus cases in the U.S. now since the pandemic began, along with more than 651,000 deaths. And both numbers have risen steadily in recent weeks. Our USVI News' Hunter Vaughn reports about concerns about a COVID surge.
As Americans gathered to celebrate Labor Day, officials braced for another possible COVID-19 surge.
It troubles me that we somehow have decided this is over and the Delta variant now is surging across America.
Despite the rise in cases, airports were still busy this holiday weekend.
Kind of made our plans to where we were pretty much not going to be in big crowds and social distance pretty good.
From coast to coast, fans packed stadiums as the college football season got underway. More than 70,000 saw Notre Dame beat Florida State in Tallahassee on Sunday, A day earlier, a similar-sized crowd was on hand as UCLA defeated LSU in Pasadena. Experts say infections have tended to rise after major holidays.
The good news is that we're not seeing a lot of breakthrough hospitalizations or deaths, but we are seeing breakthrough cases and breakthrough long COVID.
The U.S. is now averaging over 150,000 new COVID-19 cases a day. That's the highest it's been since its peak in January. Hunter Vaughn, USVI News.
So as some students here head back into the classrooms this week, in our neighboring territory, Puerto Rico's Department of Education is going to begin testing their students to avoid an increase in COVID-19 cases. It's just one way that they're trying to keep kids in the classrooms. Our USVI News' Christian Ramos reports.
As a result of the increase in pediatric COVID-19 cases in Puerto Rico, the local Department of Education announced that they will be aleatory testing students to minimize outbreaks and infections in schools as part of the preventive efforts carried out together with the Department of Health. The decision comes as Puerto Rico registered an increase in infections in children from 0 to 9 years old for whom vaccination has not been authorized. In the last week, more than 400 positive cases were reported between those ages. According to the Secretary of Education, Eliezer Ramos, by doing the proper testing and tracing, the department will be able to respond quickly to possible infections or outbreaks between students. However, Ramos explained that they need the parents to collaborate because the process could not start if they do not authorize their children to be tested. Some schools have already obtained 100% of the authorization, but there are others in which only 50% of the parents have agreed. 2 weeks ago, around 751 public schools started in-person education after more than a year of being virtual. Since then, at least 278 cases of COVID-19 have been reported between students, 97 between school personnel, and 64 classrooms have been closed. Reporting from San Juan, Puerto Rico, Christian Ramos.
So as many kids are heading back into the classrooms, many other children continue to learn virtually. Parents often struggle to put limits on how much time their children spend on screens, and new research is showing why that battle could make a difference, which lasts a lifetime. Reporter Elise Preston has this story.
Rachel Wall and her family live in London, where the kids enjoy lots of time outdoors, but they also enjoy their screen time.
Some mornings it's, I want a show right now, and I've learned as a parent, if I give in, it becomes a daily request.
Instead, she tries to encourage more reading, and a new study in Canada shows why it's a crucial balance.
Reading is actually quite foundational and predictive of a lot of outcomes for children.
Brienne MacArthur is a clinical psychologist. Her research identified a vicious cycle between screen time and reading.
What we found was that children who were using higher levels of screen time at age 2 were having lower levels of reading at age 3, which then predicted higher levels of screen use at age 5.
During the pandemic, it was harder than ever to limit screen time, especially with many schools switching to remote learning. Now, families are struggling to get back on schedule.
The American Academy of Pediatrics recommends for children ages 2 to 5 limiting screen use to 1 hour per day. For children under 18 months, no screen time at all except video chatting. One way to encourage more reading is for parents to lead by example.
These early reading skills are quite predictive of how children will do later in school, whether they'll graduate from high school, whether they'll be successful in different aspects of adult life.
Wall says knowing that inspires her to try harder.
We've already been rotating through different books, and you can see they still love it.
And the benefits could last a lifetime.
Great reminder to pick up a good book.